One of the main goals of an internship is to learn from experience. And by this, we mean that you're applying all your previous classroom learning and other life and work experiences to the internship setting, and then reflecting on and analyzing your internship experiences to get the best possible learning in the classroom. You can later apply these reflections to future work settings. So the objectives for this week's module are to explain your role in learning from experience at your internship setting, to describe the elements of the integrated processing model found in our textbook, to define evidence-based practice and apply this method to your work at the internship site and on the case analysis assignment. And that also includes learning how to find good references and resources, good scholarly and credible references for your papers. So, what are the elements of learning from experience? First of all, learning from experience takes intentional effort, and there's different ways we can learn from experience. Reflection means that we stop and take a step back. We give serious thought or consideration to our experiences. This can be done privately with ourselves, with our supervisor, with our classmates. It can be done in a journal or in the assignments that you have for the class. And then you want to do some analysis. You want to apply the knowledge and experience that you've gained to an assignment, such as the case analysis assignment. So you're applying critical thinking skills to your assignments using previous course content and reviewing current literature on whatever the topic of your case analysis is. You want to also consider using the integrative processing model found in our textbook, and we're going to go over it briefly in a minute. You also want to use the evidence-based practice model, where we apply not only our own experience, but the experience and research of our fellow professionals. So let's take a minute to talk about the integrative processing model. It is a process that helps you to make meaningful connections between your previous classroom learning, your previous readings, other sources of knowledge you have about the profession, with your current internship experience. And while the model is self-guided, you can also use the guidance of supervisors, classmates, and instructors to help you integrate your learning about the internship. We use the integrative processing model to reflect on and apply critical thinking skills to our work. And also you can use it in your supervision meetings to discuss specific experiences you're having in your internship. So this is what the integrative processing model looks like in a diagram. And we're going to start at the top. So the first step in the process is gathering data. You gather data from your client, from the client support system, from your supervisor, from other staff, from fellow students, from your instructor, and from your own experiences. And then you reflect. You reflect on your values, your emotions, your assumptions, and your reactions. How do you feel about the situation? What memories or personal experiences does it evoke? You also want to identify relevant theories and knowledge from previous learning and from literature review, and that will apply to the situation. You want to examine points of dissonance. We're going to talk a little bit about dissonance in a minute. Dissonance between the theory and your own view, between agency practice and your comfort level, agency practice and what you've read about in the literature, between knowledge of what is the right course of action versus your feelings. And this dissonance is a little bit related to ethical dilemmas that we talked about earlier. And then you want to articulate what you've learned and try to articulate that with clarity and coherence. This process helps you to identify gaps in your knowledge and realize what you still don't understand. And then you're going to develop a twofold plan: how to proceed in the work situation that you're analyzing, and also how to proceed in your own personal learning and growth. So dissonance is an important part of the learning process. It's defined above as a lack of agreement, harmony, and consistency. And intellectual dissonance is the kind of divergent theories or bodies of knowledge, or the difference between different bodies of knowledge, or the difference between a theory and your own views and values, the difference between what you should do and what you want to do. Sorry. between your thoughts and your feelings, between theory and practice. And one form of distance can be an ethical dilemma. If you think about the case examples in the reading for this week, you can see that there was dissonance with what the elderly client said about her situation, the intern's feelings about the client's situation, what she thinks is best versus what the client wants. So there's also some distance related to theory, between the theory of client self-determination and the intern's values that parents should be cared for by their children, between her feelings of the clients being in danger versus what has happened so far. So there was a lot of dissonance in that case. Some of that was ethical, some of that was more situational. And then the administrative example in our textbook, there was dissonance in what the assignment was to teach a class versus what employees wanted or needed. Also, dissonance in what the intern thought it meant to be prepared for a presentation and the reality of what it meant when she was standing in front of the class. And between what she thought she should do and what she wanted to do related to marching in and telling the HR director about the employee's satisfaction. So we need to use those moments of dissonance to help learn and grow. So related to the integrated process model, and another way that we learn from experience is through evidence-based practice. Evidence-based practice is the integration of the best available research with clinical expertise in the context of patient characteristics, culture, and preferences. So you can see in this chart that there's three components to evidence-based practice. There's the research or the professional literature that we refer to. There's our and our colleagues' experience and expertise. And then there's the client's context, the client's own preferences and experience, and how all these come together to form the best intervention or practice that we can provide. So in evidence-based practice, we give equal evidence to these things, to the client situation, to the client's goals, values, and wishes, to the best available research, and to the clinical expertise of us and our colleagues. In other words, we learn from the experience of research, from our own experience, and from the experience of clients. So these are the many different sources that generally inform our practice. These are the things that help us to learn. So we learn from our supervisor, we learn from our colleagues, we learn from the textbooks from our courses, we learn from going to conferences and workshops, we learn from reading professional journals, we learn from searching the internet, we learn from self-help books, we learn from our own experience, and we learn from our clients' experience. I think that evidence-based practice developed to bring more of a focus on using research and keeping up to date on the research progression, as opposed to just practicing based on what we learned in school many years ago, the way we have always done things around here, which you can often hear in an agency, where people just say it feels just like the right way to do things, or has worked for a couple of clients, so I'm going to keep doing it. Or sometimes we base everything on the client experience. If the client is satisfied with the services, we think we've succeeded, even if there isn't any clinical improvement. So in the evidence-based practice model, we're being a little bit more deliberate and a little bit more analytic in our approach to what works and doesn't work. In social work, for example, most agree that evidence-based practice is a process involving creating an answerable question based on a client or organizational need, locating the best available evidence to answer the question, evaluating the quality of the evidence as well as its applicability, applying the evidence, and evaluating the effectiveness and efficiency of the solution. So these are all the steps in the evidence-based practice model. We're going to look at them in a bit more detail. So first, we want to assess the situation using an appropriate assessment tool. So you may have an assessment tool that your agency has, or you may have a set of assessment questions that you generally ask, or one that you find in the textbook. From the assessment, we should be able to identify a question we need to answer in order to solve the problem. The question should be clear and concise, specific and measurable. What is the problem you're trying to address? You're gathering information to define that. And then you're going to ask an answerable question. And here are some examples. How effective is this intervention for my client? Or, what is the most effective intervention for this problem? Or, what is the most effective prevention method for this problem? How can I help my client to maintain the intervention so the problem does not recur? Will doing the intervention result in the desired outcomes? Or how does X intervention compare to Y intervention? So depending on what the situation is, maybe one of these questions is the question you want to ask, or maybe you'll come up with a different question. But it needs to be a question that can actually be answered based on gathering information. Then you're going to acquire the most relevant and best evidence. Maybe you'll do a search on the internet or a database search, and you need to identify what the key search terms are for that and find the most relevant databases. And our library and our librarian can help you with this. Once you've gathered the evidence, you need to critically analyze, evaluate, and appraise the evidence. Are the articles you gathered, is the research sufficiently rigorous in study design, data collection, data analysis? Or is it just an article in People magazine, which is not very rigorous? You really need to appraise the evidence that you've gathered to make sure it really meets the criteria of evidence-based practice. So what is that? What are the best sources of evidence if you're wanting to gather evidence around the intervention you're either doing or have done? This pyramid shows what are considered the best source of evidence to use in developing an intervention or solution to the problem. So the first is evidence-based practice guidelines, or best practices that are developed by a panel of experts who bring together current research. And you can often find these on websites, and I'm going to tell you about a couple of those websites. The next is called meta-analysis or systematic review. And this means that a number of independent evidence-based studies are brought together and analyzed, and so bigger conclusions are drawn. A systematic review is a literature review and synthesis of the evidence-based literature on a particular topic. Next are primary research peer-reviewed articles. These are articles submitted to a reputable professional journal that are reviewed by experts in the field to check on the quality of the study, including methods used and conclusions reached. When you're reading an article or book chapter about a particular intervention, you need to determine what type of research was conducted. Was it a randomized clinical trial, an RCT, which is the gold standard of research, where a subject is randomly assigned to either a research or control group? Was it a cohort study, which is a study of a group of people in relation to a particular outcome, where the groups differ by a particular characteristic? Was it a case study that compares patients with a diagnosis or problem with those who did not have the problem? Next are program evaluations, which are undertaken by organizations to see if a particular program they developed is effective. Rarely are they conducted by an outside evaluator. Often they are conducted internally. And they might include surveys, analysis of client data, or qualitative interviews. Finally, our own experience and expertise and experience of our clients and colleagues is important, though without research we cannot necessarily prove that it is true. So these are some evidence-based web resources. So the Cochrane collaboration and the Campbell collaboration have some of those meta-analyses and systematic reviews that I mentioned. They can be a very good source for good evidence-based practice. And then there's some other websites. The TRIP database, for example, is a clinical search engine designed to allow users to quickly and easily find and use high-quality research evidence to support their practice. These are good resources for you to use as you work on your case analysis assignment. So again, related to appraising or analyzing the evidence, you want to look at the validity of the work, the degree to which a result from a study is likely to be true and free from bias. So for example, that they didn't select clients based on the probability that they would succeed in the intervention, and they allocated clients randomly etc. Reliability is the extent to which an experiment, test, or measuring procedure yields the same results on repeated trials, produces similar results under consistent conditions. The impact is the size of the effect. Obviously, if you're reading an article that talks about the results of working with one client, it isn't going to be as impactful as the results of a study working with 100 clients. And then you want to make sure that what you're reading about is applicable. So if you're reading about an intervention that was done with someone, a child, and you are going to apply the same intervention to an adult, that may or may not be applicable. So we need to learn to be judicious and discerning consumers of research. And in the Blackboard course, in the module folder, there are several resources on how to evaluate a research article. These are just some examples here. Once you've evaluated the research and made sure that it's sufficiently rigorous and scholarly, then you need to apply it. You need to integrate the evidence with clinical expertise, client unique circumstances, preferences, and values to develop the intervention. And you want to develop your intervention in collaboration with your client. You want to share the research with your client to show them why you want to try a particular approach. And then once you have conducted the intervention, you need to determine, did it work? Why or why not? What evidence do you have that it worked? What if you tried something a little or a lot different? You should be documenting the intervention and the client's response and gathering evidence to evaluate its effectiveness. And then you want to disseminate the results, even if it did not work, so you can allow others to learn from your experience. If it did work several times and in several situations, you might want to disseminate your results more broadly, even by writing your own journal article, and you might want to adopt that approach in your agency. And then finally, you want to analyze and evaluate the process. Did you do what you set out to do? Were there any unintended consequences? Could the changes that happened be attributed to something other than the intervention? And then what is the client's evaluation of the experience? Can you apply this to other clients in other settings? You'll be hearing a lot about the evidence-based practice model in your internship setting, hopefully. And I just want to summarize today's session by saying that internship is a place where prior learning, reflection, your experience and your colleagues' experience and expertise, research, and client experience and context all come together to provide you with the greatest learning.